Good afternoon, everyone, and thanks so much for joining us here on KXAN Live. I'm Will DuPree. Hey, right now we want to show you one of our top stories on our website at the moment. It's an in-depth report from our investigative reporter, Avery Travis. The headline here reads, Cancer doctors answer your questions, bust myths about mammograms during pregnancy. This story looks closely at a maternity myth that could allow cancer to grow in pregnant women. In just a moment, we're going to have an extended live conversation with Avery and two cancer doctors. They're going to answer some of your questions, so if you have any, please leave them in the comment section on Facebook. But for right now, we'd like to first show you Avery's report, and then on the other side, pick up the conversation, so please stay with us.
So tell me a little bit about your family.
Sorry. I'm already getting emotional.
Just minutes after we sat down with Yvonne Gonzalez, it was clear. Her family is her whole world.
Being called mom. Just going to the grocery store and them missing you and just running up to you with their arms open.
For years, she says she dreamed of being a mother, but struggled to get pregnant and even had a miscarriage in her 20s. Finally, at age 33,
the day I found out that I was pregnant with my first was the happiest moment ever, and kept having more and more. And if I could have another one, I would.
But Yvonne's growing family came to a halt when she found a painful lump in one of her breasts. She noticed it while breastfeeding her second daughter and while already pregnant with her third child.
And she did all the right things. She brought it up to her doctor, she got an ultrasound, but the ultrasound didn't immediately identify an obvious mass.
Doctors at the Austin Cancer Center explained women over 40 are encouraged to get a mammogram every year.
And this clip is perfectly placed.
But a different type of scan with no radiation, an ultrasound, is often the first screening step for a younger woman with a cancer concern. Then a mammogram could follow.
However, it was not followed by a mammogram because she was pregnant.
A quick search online reveals just how many questions and concerns there are out there for pregnant women. One of the most common questions, should I get my mammogram? Well, according to the American College of Radiology, the radiation levels in a mammogram are low enough to be safe.
Why are these misconceptions so common?
I think in general, there just has been hesitation around the pregnant woman to do any of the things that we typically do in healthcare. And we are slowly chipping away at that.
Meanwhile, several studies predict more expecting moms to be diagnosed with breast cancer as more women delay pregnancy later in life.
How much of a difference to someone's prognosis could 9 months make?
Someone can go from a stage 0 to a stage 4 in 9 months, depending on how incredibly aggressive the tumor is.
When her pain persisted, so did Yvonne. And despite being in her second trimester of pregnancy, this time she got a mammogram.
Thank God that Yvonne didn't let it go. And she went and got it checked out. Because then the mammogram showed 14.5 centimeters of calcification, spanning the entirety of her breast from here to here. That's a very large area of calcifications, and all of that was cancer.
I thought of my children. Me finally becoming a mother of not just one, but 3, and to not be here for them would be the hardest thing ever.
Okay, so the label.
That's when Yvonne met Dr. Kolluri and Dr. Hossain. She had to undergo a mastectomy, but the doctors call her second screening a game changer, saving her from developing a more invasive or even untreatable cancer.
So do not let yourself be silenced. Do not be intimidated by any physician in X, Y, and Z. You know your body better than any physician knows your body. And so it is so important to understand your concerns and be an advocate for yourself. And at the end of the day, if we do a workup and everything is negative, you're reassured.
You okay, my love?
3 months after her surgery, Yvonne gave birth to a healthy baby, Mason. She still faced a long road of radiation and is now taking hormone treatments that prevent her from getting pregnant again. But
I was in tune with my body, and I kept, telling my doctors, something's wrong. It's not normal, and, it feels different. And so I'm glad that I got checked. I'm glad they caught it when they did. And
yeah, Dad was with me.
Now I'm cancer-free. and I'm able to be here for my babies and for my family.
Well, right now I am very pleased to welcome investigative reporter for KXAN, Avery Travis, as well as the two doctors that you saw in the piece there, Dr. Sangeetha Kolluri and Aneesha Hossain. Dr. Kolluri is a breast surgeon at the Austin Cancer Center, and Dr. Hossain is an oncologist and hematologist. Welcome to you all. I appreciate you being here.
Well,
Thank you so much for having us.
Thank you for having us. It's a
Yes,
pleasure.
so we're navigating some different technical things. So if we all speak over each other, that's all okay too. We're all getting used to this kind of virtual life. But Avery, I want to bring you up first and ask you how this story came to your attention. I know you get lots of story tips over the years and weeks and months and days. So how did this one really grab you and come to your attention?
Well, you know, oftentimes we come up with stories on our own. I'm digging through records, I'm digging through things, but this story, I have to give all the credit to the doctors themselves. These two incredible doctors actually came to me. We were discussing a different story that had to do with pregnancy concerns and I believe the COVID vaccine, but they told me they had an incredible survival story that they just felt like our viewers needed to hear and see, and that was Yvonne's story. So all the credit goes to them for recognizing how important her journey was and feeling like our Central Texas viewers needed to hear her story as well.
Yeah, I just cannot get over this because, you know, during a pregnancy, a woman is so focused on carrying that child to term and having a healthy baby afterward. But then on top of it, to deal with cancer, that's so shocking and surprising, but it happens. So, Dr. Kolluri, I was wondering if you could just explain how common a diagnosis like this is among pregnant women.
Yes. So 1 in 3,000 women are diagnosed with pregnancy-associated breast cancer, and that includes cancers that occur during pregnancy and in the 1 year postpartum. That's defined as pregnancy-associated breast cancer. It's more common than you think. And unfortunately, these cancers are often mistaken for being benign pregnancy-related breast changes or benign breastfeeding-related breast changes.
All right, and then Dr. Hossain, I'd like to ask you, what kinds of symptoms or things should mothers look out for if they're seeing this story and kind of maybe worrying about it?
Absolutely. The biggest thing that Dr. Kolluri and I both really want to get through is for women to really know their breasts, because breasts are extremely heterogeneous. My breasts are not the same as another woman's, and my breasts change with hormonal fluctuation. And so it's really important to know your breasts at baseline and how they feel, and know if anything really feels different from what's considered to be quote unquote your norm. If you feel any new masses, continue to feel them. Make sure that they don't change and particularly get larger in size. Things like skin dimpling, nipple retraction, any sort of changes around the skin of the breast where it kind of looks almost like an orange peel, what we call peau d'orange, is considered to be concerning for an underlying breast cancer. But all of those could be benign and they could be possible malignant changes. But the biggest thing is, if you do notice any sort of breast-related changes, continue to monitor them and don't hesitate to bring that to the attention of a medical professional should you be concerned.
You know, doctors, one of the things we talked about most was just empowering women and really all patients to ask those questions. I think something we also talked about was getting a second opinion if you still have concerns. Talk through what it is that you want people sitting at home to know if they have concerns or if they're seeing certain symptoms like that. What do you empower them? What's your message to them?
I would start by saying that the most important message is be the boss of your own body. And when you notice a change, speak up and say so. If you feel that it needs to get attention, bring it to your primary care doctor or your gynecologist. Ask for further imaging if you feel that that's what it would take to get this further checked out. If the imaging is normal, yet you still feel like you're feeling a mass, which is what happened to Yvonne, ask to see a breast surgeon. Ask for an evaluation. Because mammograms are pretty good at catching cancers. Ultrasounds are pretty good at detecting what's going on, but nothing's 100%. And if you know that what's happening is not normal for you and is atypical, make sure you see a breast surgeon and get it checked out.
And again, if you're just joining us, we have two doctors who are here talking about a little bit more about what Avery reported last night about this incredibly emotional story about a woman who found out she had breast cancer while pregnant. Avery, I'm wondering if you could pick up and let everyone know where Yvonne went with her treatment after her breast cancer was diagnosed.
Yeah, I know that is a huge part of the story that, you know, I wish we'd had more time to get into, and the doctors can talk us through that as well, because after having surgery, having a mastectomy, she still had a long road ahead of radiation and hormone therapy that I'll let the doctors explain the science behind. But from an emotional standpoint, I know you can tell, spending just a few moments with Yvonne, it was scary. It was terrifying, all the steps she had to go through. So the strength that she showed, and she told me what really got her through it was thinking about her kids, her two daughters, and then the son that she was carrying at the time. So doctors, if you can get into for us the science behind navigating a cancer treatment for an expecting mother.
Yeah, so that takes a lot of communication between all of the physicians that are on board. So it was Dr. Kolluri and I speaking on the regular, as well as Yvonne's OBGYN, seeing exactly where she is throughout her pregnancy, because trimesters are very important in determining which treatments would be able to be performed versus which ones would not. And so for her, it was particularly emotional for me because I was pregnant at the same time Yvonne was. And so I was 2 months ahead of her. And here I am in my third trimester, and I meet this incredible woman who just took so much initiative and knew her body. And I saw her in second trimester being diagnosed with what's called ductal carcinoma in situ. So essentially a breast cancer that is confined within the ducts themselves and is not considered to be invasive by definition. And I told her, you know, we're working with Dr. Kolluri. Surgery is the cornerstone of all breast cancers, should they be resectable, which in this case it was. And so Dr. Kolluri was brave enough to go and take her to surgery with the little one kicking. And so I'll kind of have her explain her experience before I can sort of talk about my experience with my treatment planning.
There's a couple of considerations from a surgical standpoint, from an anesthesia standpoint, and I was very fortunate to have a wonderful team at the hospital that we operated at, which was the St. David's Medical Center, that we all worked as a team to make sure that everybody was on board. We had fetal monitoring throughout the case. We had a wonderful anesthesia team that helped keep her pain-free during and after the procedure. There's a couple of technical considerations. When we do a mastectomy, in this case, we'd also be checking for a lymph node, a sentinel lymph node biopsy. There are some materials that can't be used during pregnancy. We have to make sure that we're not going to be exposing the patient and the fetus to those medications. But actually, she did wonderfully after surgery, and she had a nerve block, which helped with pain control so that we could actually stay fairly narcotic free in the postoperative period, which is safer for her and safer for the baby. And she actually had a wonderful, very smooth recovery with no issues. All her drains came out very timely fashion. So once she completed that surgery and was able to proceed with the remainder of her pregnancy all the way through delivery, she was actually able to breastfeed safely on her healthy left breast. And she was breastfeeding directly and pumping. So she was actually intentionally inducing an oversupply to be able to supply him with breast milk for longer. And that was a real success story for her.
Doctors, we had been monitoring our Facebook feed, so if anybody's out there watching us on Facebook right now, send us some questions and we will direct it to the both of you there. But a situation that one of our viewers brought up, and I'm just going to read this off my phone really quickly, a woman named Celeste, she said that our reporting obviously is about mammograms at the moment, but she said, I had benign tumors all over my thyroid for 7 years before I got pregnant. I would get yearly ultrasounds. I missed the thyroid ultrasound the year that I was pregnant. Right before my twins turned 1, I was reminded that I needed an ultrasound. During that 1 year, the ultrasound showed that 4 tumors were now malignant. And her question to both of you is, would pregnancy accelerate the growth of cancer cells?
So some, as a medical oncologist, some thyroid cancers can be driven by hormones. They are particularly rare. It's a little difficult to answer that question without knowing exactly what type of thyroid cancer was happening. However, pregnancy typically does not accelerate cancer. Pregnancy is a state of increased estrogen. And so if cancers are fed by estrogen, such as hormone-related breast cancer, the answer is yes. But in general, cancer is not a state where many are predisposed to having cancers occur.
All right, and taking just a bit of a shift, Avery and I had kind of talked off camera because we've done so much reporting about COVID-19 and in particular vaccinations. I thought it was important maybe to kind of delve into what the advice is for pregnant women getting vaccinated against COVID-19. So if you could kind of address how do you dispel some of the misinformation out there, if you wouldn't mind sharing some of the conversations you've had with your patients.
Absolutely. So I think there is a physician in the community by the name of Amanda Horton, and she had shared a really beautiful post on Instagram that I actually shared on my Instagram as well, and I think she really captured it quite well, is really the risk of getting the COVID vaccination, which we know works. Unfortunately, with the increase of COVID that we have seen, we're seeing that many, up to 99.4% of people that are hospitalized are unfortunately unvaccinated. In comparison to those that are vaccinated, happen to find their way in the hospital, present with a milder presentation. So the risk of a COVID infection in a pregnant lady versus the risk of the COVID vaccine. And we're knowing that people that are unvaccinated are getting a more severe form of COVID in comparison to those that aren't. The COVID vaccine has not shown to demonstrate any birth defects or any sort of morbidity to the mother being pregnant. It does not impose any sort of health risks to the mother or any health risks to the fetus that we are aware of. And one of the bigger things also that we do know, and I would like to speak of, is the role of the COVID vaccination in women that are lactating and breastfeeding. I was one of the first people to be getting the COVID vaccine while breastfeeding my 1.5-week-old. And I cannot say how incredibly excited and privileged and fortunate I felt to be able to get a vaccine to a virus that has taken the world by storm, and later down the road, as a part of a clinical trial, know that I am conferring immunity to my now 8-month-old baby. So not only do we see that vaccination promotes healthy mothers, as well as healthy lactating women, but you also confer immunity to your baby that's breastfeeding and are protecting your baby in utero.
Well, thank you so much for addressing those kinds of concerns. I know a lot of people have that information floating out there, so it's best to get the facts about this in particular. One other thing about the pandemic, what impact have you seen it have on cancer diagnoses and maybe even people getting screened for cancer too?
I would say, unfortunately, it's had a negative impact. It's not just that people were delaying mammograms. They were also not physically going in to see their primary care doctor or gynecologist. And many times you go in for something else, they say, hey, by the way, you're due for that mammogram. Or by the way, let me do that breast exam. And wait a minute, there is a new mass present here. Let's get that checked out. So this was a bit of a double hit, actually, for patients. And I actually had one day in my clinic where all 4 cancers that walked in the door had tumors that were actually breaking through the skin on the breast. And that is a very locally advanced state. That was a hard day for me to see that much locally advanced cancer. So we are now in a place where it is safe and appropriate to continue mammogram screening for everybody. We strongly encourage you to do so. All of the local radiology facilities are very much prepared to handle taking care of you in a safe manner so that you're not exposed to COVID. But obviously the best thing you can do for yourself to protect when you're going into healthcare facilities is to be vaccinated yourself.
Absolutely. And in addition to seeing more de novo cases, so just spontaneous new time cases of various cancers, I focus in breast cancer as a medical oncologist, but I see all cancers. And so that goes for breast cancer. I'm seeing a lot more colon cancer. In addition to that, I'm also seeing more recurrence of cancer in breast cancer survivors. Unfortunately, because, they were very scared in getting their annual mammograms during COVID. And so it's 2 years down the road, 1.5 years down the road, and they were unable to perform their mammogram given COVID restrictions and fear surrounding COVID. And now we're seeing local recurrence of the tumor bed, which is honestly very, very unfortunate.
A question for you all, for someone who might be scrolling past this post, this story, or this Facebook Live, and saying, I'm not pregnant. I'm not trying to get pregnant. Maybe many of our men out there, any lessons from you doctors, any warnings for, the non-pregnant population or our male population, any warnings for them to be aware of as we're coming through this pandemic? Anything you all have seen, like you said, from the broader cancer spectrum, any warnings for anybody else out there?
For me, from a surgical standpoint, I can't emphasize enough the importance of getting vaccinated. All the medical care that you receive, whether or not it's cancer care, if you have COVID, that's the ball game. Your surgery gets canceled. I spoke to a plastic surgeon today, someone that I work with very closely, who had 2 cases canceled very recently because they were COVID positive. And these were ladies who really did need their breast surgery. But unfortunately, we have to do what's safe, not just for the patient, but also safe for the medical staff. So we're only going to do surgery under the conditions of COVID positivity when it's a true and dire emergency, like in a trauma. So unfortunately, if you are not COVID vaccinated and then you turn out to be COVID positive before surgery, your surgery is going to get canceled. If you have cancer, that means that your chemotherapy might be delayed or your radiation might be delayed. And we don't ever want to have you in that kind of unsafe position. The risks of COVID vaccination are so low. It is such a safe vaccine. And the risks of contracting COVID and getting sick from COVID, getting hospitalized from COVID, dying from COVID, they are so high. It's just not worth it.
I'd like to echo what Dr. Kolluri mentioned as well from a medical oncology perspective. It is absolutely devastating for me to know that I've been part of journeys of patients that have been fighting the good fight and getting surgery and getting chemotherapy and doing everything right, but unfortunately had made the elective decision that because they have a cancer diagnosis that they would not like to get vaccinated, and have seen my patients after being in completing treatment, unfortunately pass away of COVID. There's nothing more devastating as a medical oncologist to see that and to see them go through that entire struggle for months and months of getting chemotherapy, to know that they didn't have any disease and did well, to see them unfortunately pass away from this awful virus. So even though a lot of people argue we don't know what's going on with the COVID vaccine, cancer patients were not in the clinical trials for the COVID vaccine, I feel hesitant to be able to get the COVID vaccine. The NCCN came out with formal guidelines clearly stating last month, if you have cancer, regardless of what treatment you are on, you are recommended to get the COVID vaccine. The only patients for which they had some mild hesitancy towards the COVID vaccine were those that had undergone bone marrow transplant for hematologic indications. And that was only because after you undergo a bone marrow transplant, your immune system is really not that robust. And so there's concern that they might not even mount a response to the COVID vaccine, but not because of concerns of side effects secondary to the or toxicity from the COVID vaccine. So getting vaccinated is huge. I unfortunately have patients that had COVID scares. Some have tested positive, some have tested negative, but unfortunately that means a pause in their therapy, whether it be chemotherapy, radiation, or surgery. If there is a suspicion of COVID or anybody in the household tests positive for COVID, we unfortunately have to take all precautions to make sure that our patients that are undergoing immunosuppressive therapy are all safe as well, and that means a pause in therapy. So we would all like everyone to be safe. We want to continue treating our cancer patients and make sure that they have every chance to be able to achieve remission. And that can only really be done if all of us continue in the effort to fight this virus and get vaccinated.
You mentioned it there, achieving the mission. I do want to end on a positive note because you guys see a lot of hardship and you see people really fighting cancer. And I just want to point everybody back to Yvonne's story because it truly is a story of hope and empowerment. So if you're sitting out there and maybe still have questions or concerns, reach out to your doctor, reach out to these doctors and give Yvonne's story a watch, not because it's my story, but because her story of survival is truly one that I think everybody needs to hear, and it just will make your day to see what a happy ending her family had because she took her health seriously and she took her health into her own hands and advocated for herself. So doctors, thank you so much for being here.
Thank you so much. And
Thank you so much for having us.
Thank you to KXAN because you put the link to the American College of Radiology guidelines on the safety of mammography when pregnant and breastfeeding. I recommend all pregnant and breastfeeding patients, if you're due for a mammogram, take that link from KXAN, print it, and bring it with you when you go for your appointment. Just in case there's any resistance, just in case there's a question about it, it's nice to be able to have the guidelines to present, and hopefully that will smooth the path for you.
Well, I just want to say thank you all to Avery Travis, our KXAN investigative reporter, and doctors Sangeetha Kolluri and Aneesha Hossain, both of the Austin Cancer Center. I appreciate you all taking the time today and answering questions and providing your expertise because this is such an important topic, and we just have to say thank you again.
Thank you.
Thank you so much for having us, and thank you so much to Yvonne. She is an outstandingly strong woman. She's such a role model. She's just such a rock star, and I don't have anything else but so much more positive things to say about her. It's been such an incredible privilege to be able to be a part of her journey, to know her. I'm so fortunate that as her medical oncologist, I get to see her every month as a part of her hormonal therapy. Sorry, Sangeetha, that you don't get to see her every month like I do. But it is so wonderful to know her on a personal level and to be a part of her life.
All right. I think that's the best place to end it there on a positive note. Thank you all again, Avery and the doctors. We appreciate it so much, and we hope you enjoy the rest of your day.
Thank you. You too.
Yep.
All right, everybody. If you'd like to read about Yvonne's story, Avery Travis's piece is available on our website right now. That's KXAN.com. You can also access it right on your smartphone on the KXAN News app, so please download it if you've not done so already. Once again, I'm Will DuPree here in the KXAN Live studio. We'll see you back here at another time. Everybody out there, please take care, stay safe, and be healthy.